This video is about vaccination. So if you are 50 years and older, you should consider getting this vaccination. Shingles vaccine, Shingrix, most important. Everyone above 50 should get it. It comes in 2 doses, 2 to 6 months apart. It protects against shingles and post-herpetic neuralgia, which is severe nerve pain. Even if you had shingles before and received the old Vax, you should consider getting Shingrix. Highly effective, about 90% protection. Pneumococcal vaccine protects against pneumonia, bloodstream infection, and meningitis. It is recommended for people age 65 or older, strongly recommended. Now, age 50 to 64, if you have diabetes, heart disease, lung disease like COPD, asthma, smoking history, kidney or liver disease, or weak immune system. Now, you have two options. You can take PCV 20, a single shot, or you can take PCV 15 plus PPSV 23 when it comes to pneumonia injection or vaccination. Annual flu shot every year, ideally before winter. High dose or adjuvanted flu vaccine preferred for somebody who is 65 years or older. It definitely reduces the risk of hospitalization, heart attack, and stroke. Yes, you heard it right. Heart attack and stroke. COVID-19 vaccine booster. Stay up to date with latest recommendation, especially if you are older than 60 and have diabetes or obesity or heart lung disease. It lowers the risk of severe disease and long COVID problem. Tdap, which is tetanus, diphtheria, pertussis. Tdap once in adulthood is needed if you never got it in your young age, and then you need to have a booster every 10 years. It's important for protection against tetanus and whooping cough. Now the new one is RSV vaccine, a respiratory syncytial virus, and recommended for anybody of age 60 or more. Especially you have chronic heart disease, lung disease, diabetes, or weak immune system. It protects you against severe respiratory infection on hospitalization. Now, there are some vaccines based on lifestyle. So, you may want to also consider hepatitis B if you haven't gotten it. For diabetes, liver disease, or healthcare exposure. Hepatitis A if you're traveling, and then there are a bunch of travel vaccines if you are a traveler, an international traveler, and that depends on the destination of your travel. So you need to find out which country you're going, what are the recommendations. You may need MMR. If you're not sure about immunity, you can always ask your doctor to check the immunity in your blood, check the antibodies if you need those vaccine or not. So vaccines after 50s are not just for the infection, they reduce heart attack, stroke, hospital stays, and long-term disability. So I wanted to have this out for you guys. I'm gonna get you guys, everybody, educated and be aware of what should be done to stay healthy. Thank you for watching.